Rachel Trobman, and I'm the CEO of UpsideHealth. Why am I the best person to lead this company? Well, I'm here because when I was in my early 20s, I was diagnosed with a mixed connective tissue disease. However, I was an unfortunate advantage in that my mom has lupus and my brother has cystic fibrosis. So I've spent my childhood growing up the complexities of the health systems and disease management. But even with this advantage, the truth is that being in pain is a pain, not just for me, but for the more than 50 million Americans who live with debilitating chronic pain. It's also a problem for the thousands of chronic pain specialists, primary care physicians, gynecologists, neurologists who all serve us. With less than one pain specialist for every 10,000 pain patients, it's one that desperately needs addressing. And COVID has only heightened this problem. The current solutions to the problem are not really working. Why? Because they lack specificity and were built around diseases like diabetes and heart disease, which are tied to objective measurements. Chronic pain is highly subjective. And the solutions also lack scale, reimbursement, and are not multidisciplinary. And it's for those reasons that myself and my team created UpsideHealth and our software solution, Ouchie, which is as personal as pain itself. Our technology is turnkey, award-winning, revenue-generating, and time-saving, and is currently being used by tens of thousands of patients at systems including Mount Sinai, Columbia Memorial, and Georgetown Pain. We license this platform to health systems and healthcare providers who then introduce it to their patients. We gather insight on their pain and pain interference and then connect them to a curated cohort of other patients to help support them on the journey. We also then direct them to integrative wellness content that responds to their particular needs at the particular time. This information is then transferred back to the provider, and with our assistance to review and report and triage the insight, we allow providers to easily deploy this technology and get reimbursed and generate revenue without creating additional clinical burden. Our providers have seen incredible results in just a short time together, and our patients have seen not only statistically significant reductions in pain score and decreases in isolation and frustration, but providers have seen revenue generation of up to $160 per patient per month. In less than 3 months within our platform, providers who have introduced our product have had 87% of their patients who they've introduced it to on board and have generated more than $9,000 per provider per month. We've also facilitated more than 75,000 interactions peer-to-peer and have collected more than 600,000 valuable data points. As I mentioned before, the majority of pain patients do not have access to a pain specialist, and therefore our targets within a health system fall under the land and expand model. We are currently generating revenue and anticipate an ARR or an MRR of 100,000 by Q3 next year. Our team is built of people who are passionate about building products that people love to use and have been doing so together for a decade. We've also held leadership positions at Stanford and the VA, and our clinical director created the playbook that is used for pain psychology and has been shown to reduce costs within the VA. Our work has been recognized by Yale, Bayer, and of course, StartUpHealth. And right now we are looking to grow both our clinical partnerships and payer clients ahead of an equity round late fall. I'm very grateful for your time and I look forward to the questions. Thank you.
Thank you, Rachel. Great job. So Rachel, talk to us about your experience during COVID-19. How has it changed your adoption or your strategy, and in general, share what that's been like for you this year?
Yeah, I think chronic pain has long been, over the past year or so, has been in the spotlight because of the risk associated with opioid prescribing and chronic pain patients. And I think this is only heightened during COVID because of the lack of ability to keep track of patients and having very low visibility. So we've had a lot of inbound, but the other thing that we've seen is that especially clinicians who focus on pain or neurology, who highly relied on injections and procedures to help bridge the gap after opioids, we're seeing a reduction in revenue, and we're looking for ways to support their practices while still offering their services. And so we've been able to expand really rapidly on that front as a result. And I think a lot of the clinicians or health systems who maybe initially had some hesitations have seen the response from their patient population, and also the way that they've been able to better operate their businesses, their practices.
And that's awesome. What about your patient engagement? Do you have any results that you can share around that?
Yeah, I mean, I think I mentioned that 86% of our users are on board when they're recommended by their provider within 3 months. The average user uses the app for more than 8.5 minutes a session, multiple times a day. We have been able to gather insights on a wide range of areas around the patient experience with pain. So everything from pain interference, functional challenges, improvements. Because we do have some free text capabilities, we've gained a lot of insight into sense and sentiment around pain, which we think will only enhance our ability to help support providers and their patients.
Awesome, so needed. Jim Liu from Stadia Ventures, can you come off mute and ask your question, please?
Sure. Thanks a lot for sharing. I'm just wondering, is there any future development plan for using this technology in sports, especially in youth sports and injury prevention, where in this space that finding the injury itself is a major pain point?
It's a really great question. We haven't looked particularly in sports, but we know the impact of spinal injury and neuropathy, as pain is really challenging in that regard. We have been exploring through our relationship with Mount Sinai's Department of Rehabilitation some issues around spinal cord injury in that regard, but we haven't partnered with any athletic groups in that regard.